Hi, welcome to Straight Talk. I want to welcome all of our new viewers and let you know that our goal is to educate the public about this opioid epidemic. Not only what the problems are, but what the solutions are, how people can get help. And today we're going to really focus on something that I think every community needs to learn, and it's really, how do you mobilize? What can we do in a community to get the police, the schools, the parents, young people? How do we get people together to fight this epidemic? This epidemic is reaching this entire country. There isn't a community that's not impacted by this opioid epidemic. And what are we going to do about it? We can't just rely on the police, and we can't just rely on government. So joining me is someone who's had many years experience in doing this, Carol Boyer, who is the National Community Relations Director. She does partnerships with Delphi Behavioral Health Group. Carol, welcome.
Hi, thank you, Mike. Thank you for having me.
It's great. You've done many years of great work. But now this opioid epidemic has probably challenged even what you're used to doing. How much of an impact in those communities are you seeing?
It's, you know, I told you before, I come from the health and fitness field, so everything's about prevention. And until I got into this field just a couple years ago, I had never seen anything like this. And it's getting worse. But if we can get into those communities and pull everyone, you know the saying, it takes a village? Well, it takes a village. And we all need to pull those resources together and work together rather than being off in silos trying to start our own things. We should be working together. So that's what at least what I'm trying to do.
Now, you know, you work at Delphi Behavior, and they have centers all over.
Right.
So I'm sure you're seeing this everywhere.
Yes.
It's not just one part of the country.
No, it's the same story, different place. It's the same thing, different day. So with Delphi, I was hired actually to get Maryland House Detox to get us open. And as you know, that's the first and only freestanding inpatient detox for the state. When I was working on that project, it was 2.5 years of working on that project. I got to know the families, got to know all the agencies in, really specifically geared around Anne Arundel County because that's where we were located. But it was all the same stories over and over again. What are we doing about this? How can we really make a dent in the problem? And the numbers keep going up, but I'm positive that what we're doing now, really getting advocates involved. These advocacy groups, they're amazing. These are people who are dealing with this firsthand. They've lost a loved one to overdose, sometimes more than one.
Now when you say advocacy group, what do you mean?
So just some folks who have lost their children have started their own groups. But you know, in Maryland, we have Maryland Coalition of Families. We have nationally, we have Addiction Policy Forum. We have Facing Addiction. These are groups that pull together everyone. They want everyone at the table to help, not, you know, to talk about what's working, what those best practices are, and really provide support for those families. They're struggling, Mike. The families are grieving. And for them, I think it helps them, just as if someone's in recovery sharing their story about their recovery process, it helps them heal. I think with these families, it really helps them connect to other families who have gone through the same thing, and for them to share the story about their loved ones. You know, you know, sometimes people relapse over and over again, 8, 9, 10 times. I had somebody, I think it was 19 times they relapsed, till it finally clicked for them. We can't give up on people, though.
But when you're losing, but here we are with 72,000. I mean, it's a ridiculous number of Americans who died of an opioid overdose.
Yeah.
You're looking at impacting tens of thousands of people, because these are the ones who died. How many are out there struggling? How many families are struggling? How many communities are struggling? You see crime go up, you see HIV go up, you see Hep C go up. I mean, all the things that impact an addiction this big in the community. And as you say, then you have those that have actually lost someone.
Yeah.
And what that
or
means.
many people, and I have some folks that I work with that they've lost 2 sons, 3 sons, twins, you know, triplets. it's a familial thing. I believe that. I believe it's a disease, and until we start treating it like a disease, I don't believe that we're going to make a dent on it. And it's stigma. You know, it's still, so many of those families are struggling in silence. They don't want to share their story.
Because we're not going to arrest our way out of this.
No.
I think we learn.
No,
We've learned that when you say it's a disease, we need to treat it. Yes, police have a role, but you're saying it's a health problem. We got to help people.
It's a health problem, and now what you see with the police and fire departments, they're taking extra classes on mental health training and healthcare classes. They're not clinicians. They're actually bringing clinical folks along with them. But I got to tell you, we have our first responders, bar none, are some of the best in the country in Maryland. From what I've seen working just with safe stations in Anne Arundel County, what they're doing and how they're trying to help other counties do.
And I'm sure this is all over the nation.
Yeah.
I'm sure every city, every county, every state has first responders who pick up the overdoses,
Yes.
who end up taking them to the hospital, who want to find help for people. Whatever you're seeing in a microcosm of one county or state has to be going on all over. And you're in other states.
Yes, it's again, the same story. It's everywhere. Maybe not to the degree that it is in Maryland. Some states are less. Some, like New England, New Hampshire, New Hampshire is really making a dent. Rhode Island, they're really doing some great work there. But I think now that there's such attention put on this, I think people are coming out of those silos. The agencies are trying to work with the advocates, with the police, the fire department, things like that. Meet people where they are. Let's get to the kids. Let's get to the kids at a younger age. High school, maybe too late. Let's get to middle school, elementary school, and start working with the kids, because it's in the families, and they see this, and we know that trauma that they experience. I'm not a clinical person, so I'll just tell you that right now. But what I know is they say between the ages of birth to 7, that's when that trauma, something happens. And so if we can get to those kids at a younger age, I think we can make a difference.
And mobilize.
Yeah.
Because we're going to talk for the rest of this show about mobilizing, about what people can do, what's their role that they can do, but just getting started, as you say, realizing there are families who are suffering from a loss, or an active addict who's there, that they need help, they need to be pulled in, the police need to be pulled in. So, we're going to take a break, and when we come back, I want to start talking about those individual roles that you've done, because you've done this. What should the police do? What should the fire? What should parents? And let's break this down so that people know.
Sure.
Okay? All right. So hang in there.
Okay.
We're talking with Carol Boyer, who's the National Community Relations Director with Delphi Behavioral Group. They provide services all over the country, and we're really happy to have her here to kind of guide us through this opioid issue. So when we come back, we're going to keep talking with Carol. So stay with us. We're coming right back to Straight Talk.
I just need a second.
Is your weight holding you back? Are everyday tasks getting harder and harder to do?
Did you see this? Your cousin's in the hospital from a heart attack.
Really?
Health risks associated with excess weight or obesity can be serious. But you can do something about it.
I know you're worried. I found this.
Take the Your Weight Matters Challenge. Visit yourweightmatters.org, where you'll find free resources to help you take control. You can start improving your life right away. Download the free toolkit to prepare you to speak with a healthcare provider about your weight and health. Your weight does matter. Accept the challenge and take charge today. Visit yourweightmatters.org.
I had big plans. I had my career path all planned out while I was on a combat patrol in Baqaba, Iraq. A rocket-propelled grenade took my arm off at the shoulder. When I came home, I felt alone. My family was around me, but I couldn't talk to them about what I'd seen. and what I'd done. I remember just thinking, man, the way I am right now, I don't want to live. I was discharged from the Army, and I've been working with the Wounded Warrior Project since 2007. Warriors don't have to be severely wounded to be with the Wounded Warrior Project. We do have a lot of guys that have post-traumatic stress disorder. Being able to share your story, I guess it kind of helps you wrap your mind around what did happen over there. Just because you've left the military doesn't mean your life is over. Because when these guys are coming home, I'm kind of leading and training them. Instead of for combat, I'm leading and training them to heal. If I come away with anything from Wounded Warrior Project, it's them giving my life back. My name is Norby, and yes, I do suffer from post-traumatic stress disorder, but I'm okay.
Hi, welcome back to Straight Talk. Once again, we're focusing on this opioid epidemic and what can communities do. Every community has people who are suffering, who have lost loved ones, who have addicts in their families. They're looking for help. We've got police. Everybody wants to work together. And we're talking with Carol Boyer, who's with Delphi Behavioral Health and who does this for a living. She works with communities. She helps them mobilize. Carol, thanks for hanging in there with us.
No, thank you.
Let's kind of break down a community. You mentioned before about there are families who are suffering. You've got police, you've got fire, you got paramedics out there, schools are out there, business. Now, you're going into a community that has nothing but problems. How do you identify the roles for everybody?
So what I typically do is I start off with the health department and community associations. So I start off our health department, reach out to them to see what services they already have in place so I can learn what that particular county or jurisdiction already has. Second thing I do is I reach out to the community associations, because those community associations, they know what's happening. They represent that one community. So that's where I start. Once I learn that, then especially like the health departments, they will connect you to the police departments, to your fire departments, to your the schools. You know, you want to be involved in what those local schools are doing, and what advocacy groups I had mentioned earlier, what they're doing. So once I do that and I figure out, it's like a puzzle, and then I figure out where I need to start. Like I said, it's the health department, the community associations, and then I start finding, okay, where are the overdoses? Who has the highest overdose rate? What part of that particular state? And then that's where I mobilize myself and then work ourselves. Like for Delphi, my job is to find out where gaps are and then help that community fill those gaps. So if there's not treatment there, let's get treatment there. Is it more a problem with adolescents? Let's get some adolescent help there. So does that answer your question?
Yeah, no, I think it's no, I think you're on the right track here.
Yeah.
You know, of identifying. Let's look at, you know, years ago we saw MAD get formed from drunk driving fatalities. And it became a national movement. We don't seem to have a group like that, but we have the people suffering. There's more families who have lost a loved one from opiates than car crashes now.
Right.
So those numbers are there. Somehow MAD got mobilized and changed laws, made an impact in this country that to this day, you say MAD, people know. Do you think that same kind of movement needs to happen with these, as you say, with these families who have gone through this?
I do, and it is. So that's the good news of this. It is happening. So there are some new groups, the Addiction Policy Forum that I spoke about that's based out of Washington. There's Facing Addiction. These groups are pulling those families together, treatment providers, law enforcement, DEA, drug courts are getting involved. They're all coming together to see what they can do to affect change, right policy. So what is going on? Or do we have enough treatment, right? We know we don't. We need more treatment beds. What can that community do? And that's what those associations are doing, the Facing Addiction and Addiction Policy Forum. There are so many, but they're the two main ones that come to mind for me that are very well respected with our legislators. They've got the numbers, they know what's going on. Almost everyone who is part of those associations has personal experience with that, and you need that You have to have that personal experience. Now, there are some that don't. If they're clinical folks, they might not have ever had any kind of problem in their family that they know of. But
probably
usually
someone
somewhere.
does.
Yeah.
In a community these days,
Yep.
I don't know anyone that doesn't know somebody who's been impacted by this opiate epidemic.
Yeah.
So I'm sure they know someone,
Yeah.
whether it's going to a funeral or someone who's an active addict who needs help.
Yeah.
But you're saying in a community you've got all these players.
Right.
Somebody needs to bring those players together.
Yeah. Now, you know what works, what I've seen, and it's these recovery-oriented systems of care, or what we call ROSC. So some counties or jurisdictions have those, some are dormant. I encourage people, go to your health department, especially the behavioral health part of that department, and find out if they have a recovery-oriented systems of care group that meets. Because you're going to get support from other folks who have lost someone to overdose or who are dealing with it right now. They have their children in recovery or they themselves are in recovery. It's prevention education is involved. You've got insurance folks that are there at the table. You've got your workforce development, because we know when somebody gets out of treatment, we know that addiction's a disease, but recovery is a lifestyle. So what happens when they get out of treatment? Where do they go? So we have workforce development that's at the table. So I always encourage people, look for those recovery-oriented systems of care. If your passion is for working with children, a lot of the schools now re-implemented the Students Against Destructive Decisions, which I know you know very well. And I think that's having a lot of impact because there's a buy-in from the kids. So it's that peer support, if you will. You know, if they hear it from someone closer to their age than me coming in and just kind of tell them, oh, well, you should do this, you should do that, they'll listen to their peers more than they'll listen to someone who's older. So, yeah, those SAD clubs are, I think they're all, I believe they're almost national.
Well, they are
coming
now,
back.
yeah, they're probably all over the country for sure
Yeah.
of what they're doing. But but as you play with the roles with the school and what they can do, and then the police, what they can do. Police seem to, you know, once again, 911, call 911. Everybody relies on the police, and they're changing their tune from just lock them up, lock them up, lock them up.
Community policing.
To saying, hey, we realize that, you know, we can't arrest our way out of this.
Yeah, I tell you, the police are doing an amazing job around the country. They're doing community policing. So really getting out in those community associations, those boys and girls clubs, they're in the schools. They want them to feel like, you can come to us. You know, we're here to help you, you know. And so they're also educating themselves, right? So the police are going out on their own and educating themselves. In addition to the work that they have to do normally, right? They're educating themselves about behavioral health. So that's a real plus. I like watching what the officers do in the schools with the kids, where they come in, they have coffee
like
with the
DARE,
cop.
and they have a lot of programs.
Yeah.
Well, we're going to take a little break, and we'll come back and kind of wrap this up in a package, because I want the viewers to really know, what can I do? What can I do? What can our community do? So thank you very much for hanging in there with us. We're talking with Carol Boyer from Delphi Behavioral Health Group. She's out in the community working with all of you and doing important work. So when we come back to Straight Talk, we're going to keep talking with Carol to give you information what you can do to solve this opiate problem. Stay with us. We're coming right back.
also spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
Most party fouls are pretty dumb. But if you decide to drink and drive underage, you could lose your license and your freedom. Underage drinking and driving. The ultimate party foul.
There's one thing you can never have sex without.
It's not something you buy.
Or something you take.
In fact, there's only one way to get it.
It has to be given to you, freely.
It's consent.
Because sex without it isn't sex.
It's rape. Consent.
If you don't get it, you don't get it.
It's on us to stop sexual assault.
Learn how and take the pledge at itsonus.org.
Hi, welcome back to Straight Talk. We're talking again about the opiate epidemic, and we can't say it enough. This is a serious problem. 72,000 Americans died last year. It's not getting any better. We're trying to put money into it. Where's that money going? It starts in the communities. It's a community-based problem, and it's going to take communities working together to solve them. Today on Straight Talk, we've been talking with Carol Boyer, who works for Delphi Behavioral Health Group. She's their national coordinator and working in the communities, doing amazing work. She's trying to help walk us through what you should do in your communities. And so we're in this final segment, and we want to kind of wrap it into a little package. If you were going into a community, you said you go to the health department, you'd also look for families who are suffering, who had lost someone, and then what? Pull them together, have a meeting with all of them, and say, okay, here's what everyone needs to do.
So that's what I do.
Yeah.
But so I will pull people together. Things are already going on in a lot of these jurisdictions, but for a family that's searching and they're in crisis, this is tough to do. That's why I always start with the health department and again the police and the community associations.
Because they're government agencies that are funding our tax dollars go into them to help us.
And they're mobilizing all around the country now because this is a public health crisis, right? So they already know where those services are being offered, where the prevention education's being done, where mobile crises are located and things like that. My thing for a family would be also to reach out to grief support counselors, and you can find those really in any state, because a lot of the folks are grieving, and those grief support counselors have access to those other resources that are available, that they can reach out. Your local hospital. The hospitals are doing some amazing work with the SBIRT program, which is screening for brief intervention referral to treatment. These are peer recovery specialists right in the emergency department who will come in and actually meet with the families, meet with the clients.
And they actually get, when you look at an overdose, paramedics show up, they hit them with Narcan and bring them back with Narcan back to life from their overdose. And if they go to an ER, where most of them will end up in the hospital emergency room, we don't want them just cutting them loose. We want them to keep them, check them, make sure, check for HIV and AIDS and hepatitis, and then try to, as you say, link them up with some help.
Connect them to services.
Because if they don't get help, they're going to go back out and do it again until they die.
Yeah, it's so true, and you got to get them in the moment. I can't tell you if in the next minute they'll want the help, but while you've got them there, you've got to be able to at least offer them services. Some people won't take it. They'll leave, but at least they know it's there. And a lot of the peer recovery specialists that I've been working with, the coaches, they will follow. They give them their cards, they will follow them, tell us you can call us at any time. Some do, some don't.
And these are placed in the emergency room.
Yes, so
and these are people in recovery.
Yes.
who can work with addicts who come in on an overdose or any other medical problem and talk to them.
Yeah.
Like you said, peer to peer.
Peer to peer, just like in the schools with those
Yeah.
SAD clubs, that peer support, they listen to one another. They're not, if somebody hasn't gone through this, why are they going to listen to them? You know, they might listen a little bit, but it's going to go in one ear and out the other. Whereas these peer recovery folks, they've been through it. They know what it's like. They've walked in those shoes. You know, they've walked the walk. So I find that I'm so excited about that program. I think that's going to help. I think, you know, we're at the beginning of it. I think that's really going to help us a lot. But again, the families, the other thing, Mike, is people are suffering in silence. They don't want to come forward. They don't want anyone to know that they have a problem. I tell you, if you're at work, go to your HR department. Go there if you need help for your family, because most likely you're not working to your full capacity if you're worried about your loved one having a disease, or you yourself are dealing with it. Go to your HR department, because they're now, the HR departments are really educated in what to look for, and if they don't know, they can also connect to services as well. So, and that's not just for the employee, that's for their families as well. So that's another good.
So when you look at this community, I'm looking at your model of what you're talking about, is that people need to, whether you're from the family that's suffering, maybe the police, somebody, probably from government, needs to take a lead and coordinate. Pull this together, because a Carol Boyer's not everywhere. Right. You know, you'll do it in the areas you're supposed to do it, but this is all over the country. Somebody has to take control, create this network that you describe, get all the players together so they're working on the same page.
And Mike, they are, but if people don't know about it, right, how will you access it if they don't know about it? But the states are doing it. They really are stepping up, and they're coming out. There were silos again, so even sometimes in the departments, there wasn't that communication about what was going on.
Well, Delphi Behavioral Health is doing it for you. They're allowing you to go out and do it.
I love it.
They deserve a lot of credit. You deserve a lot of credit. It's hard work, but there's a lot to do, so thanks. Thanks for everything that you do. Again, on Straight Talk, we're talking about mobilizing against this opioid epidemic. We can do something about it. We need to work together. We need to mobilize our communities. We need to provide treatment for those people that need help, and work together to make it happen. We're losing way too many lives. I want to thank Carol Boyer for being my guest. Thank you for watching Straight Talk. Good luck for everybody. We got a lot of work to do, but I know we can do it. So thanks for watching, and we'll see you next time on Straight Talk.